My special interest is treating kids who have chest wall deformities. Most of what we see is pectus excavatum, where kids have a depression or a bowl in the middle of their chest that can cause compression on the heart and lungs and difficulty with exercise intolerance and chest pain. Another common chest wall deformity that we see, not as common as pectus excavatum, is pectus carinatum, where there's a protrusion of the chest wall. And then some kids are, unfortunate enough to have both. They have a depression and a protrusion, and we call those complex chest wall deformities. And then we see kind of a variety of congenital rib anomalies and other things in the chest wall that do come to our clinic that we treat. For most kids, we are probably going to recommend surgery, particularly with pectus excavatum, but we also have several non-operative treatments. For pectus excavatum, we have a vacuum device that we use. For pectus carinatum, we use orthotic bracing. Really, every patient that comes to our clinic, we're going to have a treatment for. And if it's early on and it's not severe enough, it'll be a non-operative treatment. If it isn't, or they fail those non-operative treatments, then we'll typically recommend surgery. Basically, all these treatments do the same thing. They put things back where they belong, and they allow the chest wall to remodel normally. We've also made some strides in the post-operative analgesia, which really allows the great majority of our patients to go home the day after surgery on minimal opioid dosing. And I think generally that's a big deal. I've always really tried to treat families like I would treat my own family, just generally to make them understand that we genuinely do care, and we're interested in providing information that relieves a lot of anxiety. Obviously we enjoy seeing kids do well and, smiling and skipping around. But a lot of what we do too is just relieving their suffering. All doctors and nurses that, care for kids realize that we're not just caring for kids, we're treating families.